The future of healthcare delivery demands innovative solutions that maximize physician time and improve patient access. Dr. Lyle Berkowitz, CEO of KeyCare, is leading the charge for how health systems deliver virtual care nationwide. With over 2 decades of experience as a practicing physician, health system executive, and serial entrepreneur, Dr. Berkowitz brings unique insights into transforming healthcare delivery. As the founder of KeyCare, he's pioneering a new model of virtual care that leverages Epic's EMR platform to create seamless experiences for both providers and patients. While together, Dr. Berkowitz shares how he and his team are building a nationwide network of virtual providers and how KeyCare helps health systems expand access while reducing provider burden. Join us to discover how Dr. Berkowitz and the KeyCare team are bringing their vision to life by offering tech-enabled, team-based care to help reshape healthcare delivery. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Dr. Berkowitz. A big welcome to our podcast today.
Hey, great to be here, Mike.
Well, given your passion for creating real-world solutions which improve the quality and efficiency of the healthcare system for both patients and physicians, as well as the friendship that you and I have built over the years as we work to move the healthcare industry forward, I'm honored to have this conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Lyle, it's almost time for our community to learn how you and the KeyCare team are supplying health systems with a network of virtual care providers working on KeyCare's Epic-based EMR and telehealth platform. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Yeah, I have so many different thoughts on that, but I really like this one driving force that I often think about as I'm creating something new, and I call it my SAD philosophy to make doctors happy and patients healthy, and that is, how do we simplify, automate, and delegate the routine activities that are overwhelming our health system so that doctors and other providers can actually focus on the really important stuff that makes a difference.
I absolutely love it. Going for SAD to make people happy. Go ahead and define SAD one more time for our community.
It's simplify, automate, and delegate the routine activities that overwhelm our providers such that they can't get to the really important stuff we need to get to.
Well, there you have it, folks. A 2-minute podcast. That's all you need from here on out. That was incredible. Lyle, joking aside, that is a phenomenal framework. Couldn't agree with you more. And it sounds like you've been using that. And, we're going to talk about your journey leading up to founding KeyCare and all the wonderful things you guys are building there. I've been following your journey for quite some time. You have been part of some pivotal companies that are moving the healthcare industry forward. Has this SAD framework been with you for some time?
Yeah, it is. I'm an engineer by background. So engineers are always looking to make things quicker, easier, more efficient. I sometimes call myself a lazy physician because I'm like, if a computer or someone else can do something, then I don't need to do it. Let me focus on, as they say, the top of license. So yes, a lot of my companies, when I think about a tool, I don't think about how do I create some complex user interface or tool that could help a doctor necessarily improve quality per se, as much as how do I take stuff off the plate to let them spend the time on the more complex stuff. And you'll see that infused in a lot of the companies that I've worked on and created.
Well, I would love to introduce your SAD to my KISS. Keep it simple, stupid, because I couldn't agree with you more. Sometimes, as you know, well, actually a lot of times, as you know, the more simple that we can keep things, especially in our complex healthcare industry, the better off we are all going to be. But you also know sometimes keeping things simple is incredibly hard to create. But you've been at it time and time again, Lyle. You guys have been doing some wonderful things along your entire journey with the companies that you've built with some. We're going to unpack all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Dr. Lyle Berkowitz, CEO of Key Care. Lyle, thank you so much for joining up on the podcast. This one has been a long time coming. Been a big fan of yours ever since, oh my goodness, years and years ago, you and I took the stage at an MGMA AMA event in Colorado Springs, Colorado. That's where I had my first opportunity to meet you and have been following your journey ever since. Lyle, it's been a hell of a journey. I know you're going to talk about it a bit and how everything kind of crescendoed into today where you are building, founding, and continuing to move Key Care forward in these pivotal times in our industry. And then, of course, we'll talk a little bit about what you're seeing on the horizon. We'll pull that crystal ball out and see what's happening, in the next number of years that we should be mindful of as community members of this podcast. And then we can't let you go until we can be able to offer out a lending hand to you and the team. As I said, this community rallied around the podcast is always willing to help our incredible guests just like yourself. But before we get into all of that, Lyle, take us a bit on that founder's journey. I know Key Care is approaching a 3-year-old birthday party. That's amazing for any high growth startup. So we'll talk about how did this all come to be in the first place? Maybe take us behind the scenes. How did this come to be, even with that amazing journey that you had even before Key Care? Take us up to today. Give us a little bit of that founder's journey.
Yeah. So as I mentioned, I was a biomedical engineer undergrad. So I always had that problem-solving mindset. Knew I wanted to go to med school. And at med school that I discovered this whole area of informatics. I had a great mentor, Arthur Elstein, a PhD, founder of the Society for Medical Decision Making, who made me his research assistant. And over 4 years, I got to learn about informatics, decision making, etc., and really start to advance a lot of what my future thinking would be like on how do we take all this cool technology and bring it into healthcare. So I did an internal medicine residency, primary care doctor at Northwestern for 20 plus years, where I always balanced my time between general clinical medicine, primary care doctor, and being a system executive in the IT and innovation spaces, always trying to sort of push and see how do we use particularly technology, but also other processes, et cetera, to make life easier for doctors and better for patients at the same time. A lot of that, of course, was rolling out our electronic medical records all the way to implementing new digital health technologies. And somehow on the side of all that, I also wound up being an advisor and eventually founder of a variety of digital health companies. That's sort of my sport. It's what kept me very occupied during that time. And eventually, when I left Northwestern, I joined MD Live, one of the large telehealth companies, as the number 2 exec there, helping oversee operations, product strategy, and really learn the national telehealth trade. And when I left there, I joined a company I had founded earlier, HealthFinch. I sort of stepped in as executive chairman and helped lead that through an acquisition. So this all leads up to the middle of COVID, where all of a sudden telehealth was becoming really important. Health systems wanted to do telehealth. Epic had rolled out its telehealth product on top of its EMR. And I had the opportunity to sit down with Epic, who I've known, of course, and have a good relationship with over the years because we use them at Northwestern, because HealthFinch was one of the first apps on their app orchard, and knew that they were getting requests from health systems to have a telehealth partner that was using Epic. So one thing led to another, and we decided to say, let's do this. Let's start a national telehealth organization that uses Epic as our EMR and our telehealth software to be really set up to be a virtual care workforce that can work in coordination with the rest of the health systems using Epic and offer something that's a more coordinated longitudinal partnership versus a transactional one-off type of telehealth. And that's where we are.
Lyle, thank you for that and taking us through a little bit of that journey. It's an exciting one, and it's so important to really frame up where you are today and being the national leader that you are. So thank you for that, Lyle. Before we dive a little bit more into all the good work happening at KeyCare, let's go back. Obviously there we are kind of at the beginning of the pandemic. You're still with HealthFinch, and then the acquisition occurred. I know we have a lot of founders and entrepreneurs that tune into the podcast. Any advice, any tidbits to share on what that was like taking HealthFinch through acquisition with Health Catalyst? Anything to share there?
So, this is a good example of having long-term networking discussions, right? I was friendly with the Health Catalyst people, and we had talked over the years about potential synergies. And a lot of things are also timing. They had just gone public. They were looking to make acquisitions. They wanted to expand beyond just analytics, telling what to do, but gain into action-oriented. This is what we can help you with. And they actually made a couple of acquisitions around the same time. And it was just the right fit. It was also for HealthFinch. We were at a time, we were about 10 years in. And at that point, as a company, as a startup, we raised a little money, but you have to make a decision. Are you a point solution that is ready to sell to become part of a bigger platform? Or do you want to go out and raise even more money and try and become a platform? And there are different pros and cons to each of those. At this point, I felt it was the best move to go ahead and become part of this bigger platform. I think it was worked out very well for both sides. And so we're super happy with it. And it's one of those things that young entrepreneurs, when I do talk to them and they ask me my advice, I'm like, be very thoughtful about that decision point will hopefully come for you. And it's a big decision point. And if you look at a lot of the most successful entrepreneurs, you'll see they did a number of these point solutions and sold them quicker versus trying, the very few companies who just start and become the Googles and Amazons with the original founders. And so gain a couple of those singles and doubles early on actually can set you up to be the big entrepreneur in the future if that's what you want.
I love that, Lyle. Thank you for kind of sharing a little bit about that journey there. Health Catalyst, obviously industry gold standard, if you will. So there we are, right in the height of a pandemic. You sell HealthFinch to Health Catalyst. Did you know that you were going to be pulled into founding and running another startup? Was that on the bingo card? And then also layer on top of, and you kind of already shared it, and let's share it again and kind of highlight it again, the power of the network, the power of nurturing relationships. As you mentioned, you had been working with Epic for quite some time, all the way through your days in Northwestern or otherwise. And then, of course, here you are partnering up with them. Did you have another startup on that bingo card, if you will, after the HealthFinch acquisition? Was that something you wanted to do, or did you kind of get pulled into it?
Like a lot of entrepreneurs who make a sale, I said, I'll retire. I'll do some investing. I'm an LP in a number of funds, and I invest in a couple of companies. And my plan was to do some part-time consulting, happily doing that, and to mentor a couple of young folks who wanted to start companies. That was theoretically my plan. But a year into that, I was getting a little bored and restless. And one of my other favorite quotes is Louis Pasteur said, "Chance favors a prepared mind." And when I went down to sit with Epic, it was really to talk about, hey, what I've learned in telehealth, where I think everything's going. And this discussion just sort of evolved. And it made sense. And I got the itch again. And you see this a lot, right? Once you do it, the entrepreneurship startups, it's like the addictive drug in the business world. Once you do it, you often want to go back. The amount of action and excitement and potential is so great. It just fuels you. And that's what happened in this case. And so I gave up everything else. I stopped all my other consulting. I stopped investing. And I really just said, I'm going to focus, because what's always driven me is can I really make a change in healthcare? And I felt this was an opportunity to make change at scale, knowing that Epic had really become the operating system in so much of healthcare, knowing that we could do something that would take advantage of that breadth while also taking advantage of the depth that Epic has as a system, just made this irresistible.
Lyle, and you really teed it up for kind of where I wanted to go next with this conversation. And again, thank you for sharing a bit on that acquisition and, getting that itch. You bored? Come on. You sitting still, if anybody knows Dr. Lyle Berkowitz, that those two things do not compute. So makes perfect sense that you founded yet another company. But all joking aside, Lyle, when you talk about just now, you mentioned Epic as an operating system. Those are important words. how ingrained and embedded they are in our industry, kind of just broadly, if you will. Did you ever have anybody say, Lyle, why aren't you doing this on your own? Why are you guys being so reliant upon Epic? And if you did get those questions, how would you respond to that, Lyle?
Yeah, I often hear that, right? What's the difference, et cetera. Yeah, I was in that national telehealth area, right? I saw when you look at the big companies in that area, you see they spend a lot of money, hundreds of millions of dollars to build their technology. And yet they don't even have meaningful UCMRs. They have very basic documentation and prescribing systems. They're set up to do transactional, one-off urgent care type visits. I'm able to get an industry standard that's well adopted, that is the deepest EMR out there for a fraction of that cost, and be able to build on and around it. So to me, one of the reasons why a lot of the national telehealth vendors have never made money is because they have sunken costs on the amount that they spend on technology. And I just said, I'm not going to go down that route. I believe that the real innovation is on established tech, not on repeating the tech. Think about it. I now have 10,000 plus workforce continually building and making the technology I use better. And I can do that much more cost effectively than trying to do it myself.
So let's talk about some of those key stakeholders, right? Epic itself, and then of course, those providers that are working within the platform to serve those patients with the health systems that you guys are partnered with. Let's talk about those stakeholders. What has the reception been like within Epic? You guys first kind of came around that table to discuss about their rollout during the pandemic, given the dire need that we had as a nation and beyond. First, how has the reception been? What's it like working with Epic? What are they saying to you in regards to the feedback about all things key care? And then, of course, let's talk about how are the providers feeling about the offering, about the technology, maybe talk about some of those stakeholders.
Well, first, Epic's been a fantastic partner, right? This doesn't happen without a partnership with Epic around this. They want it to happen. I wanted to make it happen, and because they've not done this before. We became a client. We're by far the least mature client, right? We were just an idea, and we had to build a company around it. So I had to build up a team of people who knew how to build out Epic and do it in a quick and cost-efficient way. We were, I think, one of the quickest builds that's ever been done on Epic, but it's because we got to focus, right? We got to make decisions without having to worry about office-based care. Everything we did was optimized around virtual care. So we are, right, a client of Epic, and they treat us like a client, and they treat their clients great. But we're also a partner. And if you go to like the Epic showroom and look at their partnership pages, you'll see us there as well, because they knew that many other Epic health systems were looking for virtual care partners, and they wanted to make sure that they were aware of us, which is obviously extremely helpful. We've also are able to work with them as a client and partner on building tech that may help facilitate the workflow of having a patient come to one Epic system, but then have their care shared between two Epic systems. This is something that Epic had developed, but quite honestly, most health systems don't use because they don't want to share their patients very easily with others. We became a neutral third party because we're all virtual, right? We're not going to do any physical office work. We're not going to steal patients. We are really set up to be a team-based approach to care. And to the doctors, we are attracting some great doctors, both because we're really setting ourselves up as a true national primary care medical group, not just a pill mill of some sort. And they like being on Epic. They're used to Epic. Almost everyone in this nation's probably been trained on or used Epic at some point if you're a doctor. And so they have some comfort level with knowing the quality of the EMR. They have some comfort level in knowing that the data interoperability means that when they see a patient, they have data from their originating sites. And when they finish with a patient, that data goes back to the primary care physician the patient already sees. And that's all very reassuring. And they also know that we're working on a variety of ways to fine tune our system to be hyper efficient for the virtual care world. And that has been a fun part of the experience as well.
And then also, before we switch gears and talk a little bit about future state, pull that proverbial crystal ball off the shelf a little bit, Lyle, and look a little bit beyond today, I would be remiss to not ask you, here we are, I hate to say it because I don't even know if this is fully in truth, this side of the pandemic, right? I think we're always going to be living with the remnant of, and we still have issues with it, of course, whether it be the physical illness or just the byproduct of the pandemic itself. But on quote unquote, this side of it, Lyle, obviously we had the huge boom of telehealth just because of the sheer need of social distancing during the pandemic. But give us a little bit of current state in regards to what is the temperature out there for virtual care? Was it clawed back a bit? Do you still see a strong need and desire? How the patient thinks about receiving care, when and where they receive it? Has the pandemic fundamentally shifted things and that are going to be with us in perpetuity? What's the kind of temperature in the current state now on this, if you will, this side of the pandemic?
I think the peak really happened relatively quickly, first few months at most. And it went down to a new baseline, within 6 months. But pre-COVID, the telehealth done at a health system was well under 1%. Now, depending on specialty, it's often between 10, 15, 20%. That's both for urgent care, but also for established follow-up, et cetera. The genie is out of the proverbial bottle. Patients now understand what telehealth is, and they like it. Almost a vast majority of the nation has had a telehealth visit. And doctors now acknowledge that, yes, this makes sense, it works. But one of the interesting things that we see is pundits who might say, oh, look, telehealth's going down. Patients want to come back to the office. That's a blatant lie. Every survey out there, and we've done a couple and others have done it, show patients actually love the concept of telehealth, particularly for what they view as routine issues that really don't require someone coming in. In fact, we've done a survey every year, which consistently shows, and we just finished one last month, that patients want telehealth options probably at least 2/3 of the time. About a third significantly prefer telehealth to coming in the office. About a third, it's neutral, whichever one can get them in earlier. And a third still want to go in the office. We're not saying that people don't want to go in. But the more routine the case is, the more likely someone wants to do something online. And if they can't do it with their doctor, they certainly want to do it with a doctor who knows their history. That's really important to them well. And the reasons are, of course, convenience and potentially not having to pay for parking, et cetera, and time lost. But they also bring up things like, I don't want to go to an office full of sick people where I might catch something. And they even bring up things like, I don't want to bother my doctor with a small issue. So the idea is not that telehealth will replace everything, but we are serious when we say 25, 50, 60% of today's office-based healthcare can probably be done online and done very efficiently and conveniently, while opening up space in the office for the patients who may really need to get in and spend more time with the doctor, which is a lot of our ultimate goal. So the big problem today is that doctors are used to being officeologists. And as an officeologist, they love to be in the office. They are completely attuned and optimized to being in the office. And from that perspective, what that means is they have everything set up for them. They often get reimbursed maybe better because they can do more things in the office, et cetera. And they often get paid, based on RVUs, et cetera. So we've set up an incentive system that makes office-based doctors want to see everyone in the office. It's a discontinuity, cognitive dissonance for them to just jump back and forth from office and virtual care. So all these things are set up to say, great, let's have officeologists. Let's have them be amazing office-based doctors. But similar to the hospitalist program of the 90s, let's create a new legion of virtualists who get really good and optimized around taking care of patients online.
Very well said. Well put. And I appreciate that. Lyle, let's go ahead and grab that crystal ball now and look a little future state. Obviously, things have changed quite a bit since the pandemic confronted every single one of us, and we're still continuing to live through that change, some good, some bad, and everything in between. But as we look a little, further into the future, 2 to 3, 3 to 5 years, what do you see on the horizon that our community should be mindful of, both on the macro for the industry, for the virtual setting, if you will, or otherwise? And then, of course, where is key care going to be in that entire future state as well?
Well, I think everyone leads with AI these days, right? And I think we're starting to see the peak and we're starting to start seeing the downside of it, right? The AI is going to do amazing things. It is going to allow for automation and delegation and simplification, right? So these are great things, but it also comes with, it's not perfect. How much time do you have to check? So far, a lot of AI that has been promoted is improving documentation, maybe improving care, maybe starting to improve efficiency, but we also have to keep a close eye on it. And I think we're going to start seeing a little trough of disillusionment coming. That's what my crystal ball is before we get to the end of the Gartner hype cycle on that. And also people have to remember, automation doesn't have to be black box AI. At HealthFinks, one of my previous companies, we focused on rules-based delegation because doctors can agree on rules. There's no black box with that. And so that is still a very viable way to deal with certain things. when we think about physician shortages and access issues, etc., I'll often say, we don't have a shortage of physicians. We have a shortage of using them efficiently. And we have to figure out how to use technology to, again, automate or simplify certain things, delegate certain things. And a lot of what I talk about is really population health and team-based care 101. Imagine if we could go to a primary care doctor and say, hey, as you see patients, once you stabilize them, we're going to give you a virtual care team who's going to monitor and manage that patient in between visits. So instead of seeing them 4 times a year, maybe you see that patient once a year. And all of a sudden, you have more time for when they do come in, and you'll have more slots open, and we can double your panel size. All of a sudden, we start solving access issues, more convenient access for the lightweight stuff online, more office-based access for the more complex things. We start solving physician burnout because we're not saying see more patients. We're actually saying see less patients, but see the ones that really need you in the office while you oversee a virtual care team who manages the bulk of your patients. And all of these things can be financially aligned in a variety of ways that are important. If we do all this well, what we do is execute the same theories we've been saying should work, but have been confounded by things like not enough office space and financial incentives not as aligned. But I believe what we're trying to do is finally say, with a virtual care team that now, because of COVID, can get paid for the care they do, which was not true before COVID. And because of COVID, doctors and patients are much more comfortable with this, and technology is much more efficient. All of a sudden, we're at the time where we can execute on population health, team-based care in a way that finally makes sense.
Very well thought out future state through that crystal ball that you're seeing. And of course, you have been living it for quite some time and know exactly where we should be heading. As a matter of fact, you've been building a lot of the future of where we are heading as an industry. So kudos to you, Lyle. For now, we will put the crystal ball back on the shelf. We will get back to current state and, of course, be able to offer up how we can be helping you and the Key Care team. What's one problem, need, or question that you and the team have that we can be helping you with?
So I think one of the biggest problems out there that I would love to see the healthcare system address more, and I'm going to be writing more about this in the future, is how we pay physicians. Much of our struggles with innovating are based on poor incentives. I don't have an MBA, but I've learned enough in business to know one thing, and that is incentives matter whether you think they do or not. In a world where a health system pays its doctors based on RVU or volume, they're going to get RVUs and volume, and they're going to get doctors who optimize around that, which in many cases means seeing as many low complexity cases as possible. That is the opposite of team-based care, where you want to have a big panel size, you want to share the care across a variety of folks, and you want to work on the upper part of the population health pyramid. So we have to start thinking about how do we pay doctors based on panel size and quality of care of that panel? How do we pay them to manage a team and to have great access for their patients? That, to me, is going to be one of the fundamentally most important things that we work on that doesn't require any new technology, that doesn't require any new special thinking, but it does require executives at health systems to rethink how they're paying their doctors and to recognize that how they pay their doctors has a huge impact on adoption of innovation, technology, automation, team-based care, etc.
And for our community members that want to engage in that conversation with you, how do they get a hold of you online? Social media handles, websites, contact points online. How do they track you down?
Well, Key Care is at www.keycare.org. My personal website, www.drlyle.com, drlyle.com. That also has links to my LinkedIn and Twitter and other social media. I'm big on LinkedIn. Please follow me on LinkedIn. I like to post on that pretty regularly on my reflections of interesting news stories I see, etc.
Easy enough. And for our listening community, simply scroll on down into the episode notes of your podcast player. All those contact points for Lyle and the team will be there. Of course, you can head over to our free global online community at passionatepioneers.com. There will be a post for this episode where you can leave comments, feedback, suggestions, or otherwise, and find all of those contact points for Lyle and the team. Again, over at passionatepioneers.com. All right, Lyle, we are wrapping it up. But before we have you head on out and get back to all the good trouble you and the team are causing at Key Care, before we let you go, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I love to make things easier.
I love it. I love it. Lyle, thank you so much for getting together today. This one has been a long time coming, my friend, and really appreciate you taking time to be with our community and sharing all the wonderful things happening with you and the Key Care Camp and where you continue to drive our industry forward. Thank you so much for all that you do for many of us, Lyle. You are such an inspiration magnet for so many of us across this industry, and for you to take time with our community today, really appreciative. But for now, again, Lyle, thank you for being with us today.
Well, I appreciate it, Mike. I remember the first time we met, and you are a ball of energy, and I really love how you're bringing everything together, and thank you as well.
Thank you, my friend.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.